Move on. All right, this paper was published recently in the American Journal about homocysteine. If a patient's folic acid and B12 falls, homocysteine goes up, and these are all toxic to the brain. This is a Chinese researcher. In Singapore, they don't have enough people, so a lot of Malaysian, a lot of Chinese researchers or Indians coming to help in the research. And this is a very big paper. We found that people with even our normal values for B12, you see all your lab, even before it mentioned it's too low, it's already having problems now. Before it's within normal range, the patients have cognitive function problems, poor memory. Okay. This paper made us all very famous. It was reported in the Australian. It was reported in the New York Times and also the Times of London. We did a big study in Singapore, and before the study, colleagues in India, I think it was the Chennai group, found that the prevalence was very low among the Indians. But after that, they didn't say anything on that. But the Americans are very clever. The Americans took that cue and then did a study. In Singapore about 2 years ago, to do a survey. Comparing all the groups, Indian, Chinese, those who take curry or those who don't take curry. All right, we found that those who take curry, it helps their memory. The deterioration for old people above 65, it helps them. But then my friend said, but in Singapore we also found Indians also the prevalence is also quite high. But taking everything into consideration, sometimes the Indians also take a lot of other fats and all that, mutton and all that. But you minus all this in the research and multiple regression, you find that those who take curry, it helps in their cognitive function. Right. All right, then cholesterol, obviously cholesterol is important for brain lipids, but also this study is going on still in Harvard in America, that whether statin can prevent the onset of Alzheimer's disease by lowering the cholesterol. Now, proteomics now the big thing in the world, research in proteins now, because the protein is where the memory is stored. A Nobel Prize winner in 1998 was a psychiatrist called Eric Kandel. Eric Kandel from Columbia in New York did a study using snail. He found that you can. Mahjong is a very intriguing game because in playing Mahjong, you must try and memorize the cards of the other people around. It's not just playing a game, although it's quite akin to playing gin rummy, but you must think, So I tried to introduce that about 10 years ago. Whoa, there's a furor of people. How can you encourage gambling old people? Old people, they gamble, you lose normally just 3 days after a pint of beer, that kind of thing. They're not going on big stakes. So, but we're doing some studies now through imaging MRI machine, people who do this activity, people who don't. And of course, because of these changes of this protein leads on to the development of the tangles, and especially you see a lot in people here, up in Parkinson's disease, there's the protein that's implicated, and the man who discovered this thing, this is an Englishman called Sidney Brenner, who also won the Nobel Prize, and is now working in Singapore, for this research. Let's move on. Okay. I think I mentioned the rest. Best on chronic inflammation as one. All right, the pro-inflammatory cytokines are implicated, but all this medication found not to be useful. I thought to be useful, but research found otherwise. Next one. All right, mental activity, playing chess, reading. All right, move on. Exercise, we find that exercise is important not only for your general physical health, but also it probably releases the endorphins, which are important in brain cell growth. I'll just shift gear now to talking about the family, how we can help the family, because I realized that if you don't help the family will see you as a doctor and ask you, doctor, can you find a home for my father and mother? That's all they want, And I mentioned to you, although I run a memory clinic for the last 15 years in Singapore, initially very few people come and see me from the memory clinic. But now, because education, people come early. But they often come when the carer is under stress. The Carer is under stress because the elderly person is walking up and down the whole night. Tomorrow you can't work, and he's creating a lot of problems, and then it's better to see a doctor, you know. And so the GP will refer to the university department for a second opinion. So the stress of the carer is something you have to look into. If you can help them out, then they're more willing to look after the person. Because I'm sure it's, even in Seremban, like in Singapore, you don't have too many old people's homes, isn't it? You don't have homes for Alzheimer's disease. We're 1 or 2 now in Singapore, but we expect the family to look after the elderly people. But it's unfair because traditionally in Asia, the family caregivers are the women. The women are now better educated. They want to be doctors. They want to attend meetings like this. You don't want to stay at home. So we can do something to help the family. So we have published a research paper, and I'll move on here, on family caregivers, next line. And it's the first paper published in Asian family, in a British journal, that 45% of caregivers seen in our memory clinic have symptoms of anxiety, depression, and these are related to symptoms of the patient with delusion, hallucination, hostility, agitation, and wandering. And all this, in fact, are quite amenable to pharmacological or even psychological intervention to reduce the symptoms of the patient and then to reduce the stress of the caregivers. Right. And I think let's go to research again. You find that if they have these symptoms of the patient with depression or the duration of care is more than 1 year, the caregiver is going to have lots of symptoms of anxiety, depression. But some people have no wrong idea about what is Alzheimer's disease. They thought that maybe after 6 months the patient may become better or might die, but sometimes it goes on for 2 years, 3 years. You know. As I mentioned to you, we was told in England it's 5 years, but in Singapore, I look after a professor of surgery who's been there for 15 years. You know. And sometimes for a long while, it's good for his quality of life. And when first time he was diagnosed, all the other professors come, oh, this is very sad. And some of you know him, you here. Oh, this is our famous professor, having Alzheimer's disease. But the wife told me after 6 months, there was no more visitor, you know. And she was alone, and she was waiting for a phone call. Sometimes I was on the way back home, I'll drop in, and they're so glad to see you, you know. So all the stress of these caregivers, right? Next one. Wow. Very important for all of us now in this these days is health economics, you know. Is medicine too expensive? The care too expensive? You know? We are able to divide dementia into 3 phases: the mild phase, moderate, and severe. And this is the cost. You know, we've done this paper in Singapore, Sing dollars. For mild dementia, the patient pays about $280 per month. For moderate dementia, it's higher, $1,250 per month. And for severe, it goes down. Now, this is because the patient with moderate dementia are very agitated, and here they must need a maid to help out. You know, they must need a maid, and sometimes they need 2 maids. The surgeon, I told you about 2 maids to help the family. And this is very stressful because although this is let's say $1,000, this is called direct costs. Anyone here into economics and all that? The economists will tell you that if this is $1,000 called direct cost, the indirect cost is $2,000. Twice the amount. Indirect cost will be like the daughter or the wife has to take off from work to bring the patient to the hospital. If sometimes they have sickness themselves, caring for old person, these are called the indirect costs. It's twice. I mention it because in Singapore we have also a Malaysian health economist, you know, trained in New York. He told me that sometimes when I was the CEO of a big hospital, the Woodbridge Hospital, you may not know that's the biggest hospital in Asia, 3,000 bedded hospital. Yeah. So I was trying to work out the economics of it, and so I invited for lunch. He told me, you do it's costing is what it is. And the patient's direct cost is the patient pays you for your fees, pays you for your prescriptions, see the doctor. This is called direct cost. Indirect cost is the other thing I mentioned to you, is twice. But later on, I have a friend who came down from the London School of Economics. He's a chap called Professor Martin Nett. He said, oh, this is wrong. It is 3 times. So the cost is very high. It's not just 1,000, it's 3,000. So I wonder what is economists, and they always tell us things that are not true. Somewhere in between. Just like even in Malaysia, sometimes they tell you the growth this year will be 10%. At the end of the year, it's actually 5%. Economy is all There's a very famous economist from America who just passed away called Kenneth Galbraith. He's the man who coined the phrase conventional wisdom, and he said that economic prediction makes astrology respectable. All guesswork. Yeah. Next one, please. Yeah. So you see, together with it, the strength